Hey guys, it's Dr. Kim Sage. I am having one of those days where I'm tired, like most of you, and I'm just trying to fit videos in. I don't have my tripod, and so I'm just sitting on the floor trying to squeeze these videos in between a little tiny break between patients. But I'm really trying hard to stick to the schedule and be consistent. So I hope you'll bear with my beach hair that looks probably a little crazy, and my blankets and my dog on the couch. But I wanted to just clear up some really important misconceptions around borderline. And Katie Morton just made a video about this, and so I thought this is actually a good time to sort of piggyback off what she said and really reinforce some things that I think are really important. Because I think with this disorder, it really is often a very demonized disorder. And I think that's why sometimes people in the comments, especially on my video on this one, if you just watch this video, it can feel, like it's really an attacking video. At the same time, as I've made these videos, they are generally more for those of you who have been on the receiving end of being a child or a partner of someone with BPD. And so my goal has been to validate. And so I know that that can sound honestly really ugly at times, that video, but it is very true. There's nothing in that video that I have not seen or experienced or heard about on some level, and frankly from many different people that is a part of that could be borderline. Now that ties into what I'm going to talk about today though, which is that there are a lot of misconceptions about borderline, and so I'm going to just discuss those, and I hope that you will stick around to the end, and please feel free to leave any questions you might have, but know that my intention is to inform and educate and support those really on both sides of this disorder, but my specialty has generally been to work with and support those who are on the receiving end. And it really is a specialty to be able to work with BPD. And so if you have BPD or you're trying to get help for your BPD loved one, it is really important that the caregiver, the clinician who should be licensed, really has experience and understanding of the different treatments and how to work with borderline, because the relationship is really vital and can be really, fragile in terms of what it's like for the borderline, especially as they're being challenged and supported and encouraged. The treatment can be difficult, and so we want them to feel they're in really good hands, and that's really important. That being said, if you love somebody with BPD and you want them to get help, I've said it in many videos, but it is not your responsibility to get them help. You can help them, you can support them, you can encourage them, you can send, resources, but at the end of the day, your job is to work on you and healing your life, especially if you've been affected by it. That doesn't mean you can't cheer from the sidelines and or set strong boundaries or maybe have no relationship. That's also something that is your right to do. All right, but let's get started and talk about what the biggest BPD misconceptions are and myths and things like that, and some truths. And so let's do that. Before I do though, let me just say that I'm Dr. Kim Sage. I'm a licensed clinical psychologist. And this channel is really about your childhood, your mental health, and your relationships, and how all those can kind of mix together to create the things that are working well in your life and not so well, all right? So the first misconception is that BPD only sort of develops out of a traumatic childhood. Now, it is true that the environment can be pretty important in terms of setting up the stage for this disorder, but the research shows there is also a strong genetic and hereditary and environmental connection and link to this disorder. And so it's not true that every single person that has BPD has been through a traumatic childhood. I think it's really common that there are often environmental issues that can often be severe, from mentally ill parents to abandonment and loss and trauma and abuse. And so I think that's more common than not, but it's not true that you have to have trauma or come from an abusive childhood or some sort of, something like that to have this disorder. And so for more information about that, you can check out this video that I made, which is about understanding BPD, and it talks a little bit more about the genetic and hereditary components. The second misconception or myth is that all people with BPD are crazy and extreme and are like Glenn Close and, boiling the rabbit in Fatal Attraction. This is actually really a very hurtful, perspective. Yes, it is true that those who are actively untreated in this disorder can be extremely abusive, extremely hurtful to themselves and other people. But I think one of the reasons why we see often this disorder being wildly underdiagnosed and misdiagnosed is because the symptom criteria can vary so much for each person. It really exists on a spectrum, like all mental health, but especially this one. And a lot of movies and films really show this extreme version. And the problem is, if you think borderline looks like that, you could have a patient sitting in your office, or you could be this person who has, enough of the symptomatology or traits that really are worthy of therapy, but maybe get mislabeled or misdiagnosed as something else, like anxiety or OCD or substance abuse, or like in men, PTSD or substance abuse. And so, or some kind of like antisocial behavior. And so it's really important to know that there is a very wide spectrum of criteria in terms of symptomatology for this disorder. The third misconception is that a person is either BPD or narcissistic. I've had some people think that I'm describing narcissism as opposed to BPD, and the truth is that, like many of the personality disorders, especially cluster B, there's a lot of overlap, and so you can see some of that flavor of narcissism in borderline, and I think that it can be confusing. So you should know that you can diagnose more than one, although we tend to try to look for what is our main goal here in treatment. But there can often be a lot of symptom overlap, not only in the personality disorders, but in other, really comorbidities that occur with BPD. So you might also have anxiety, you might also have PTSD, you might also have substance abuse. And so it's important to sort of understand that there doesn't need to be an either or situation. The next one is that there is no treatment, right? That it's a crazy making disorder and there's no treatment. The truth is that treatment has come an incredibly long way. And I think when I've also made this video, there are people who sort of got offended because in the newer generation, the last, I would say 10 to 15, 20 years, there's been an emergence of different therapies and understanding of BPD. Whereas for many of us who may have parents who were, let's say, in their 60s, 70s, 80s, there really weren't that many great treatments or options. And treatment with borderline can be challenging and difficult, but it is important to know that there are treatment options, and it has been very successful for many people. And the success rates have gone way up over the years. Now, that implies you have to want to be in treatment and open to receiving it and then commit to treatment. But you should know that it is not a diagnosis that has to be, a death sentence in terms of relationships, that people who are motivated to get better especially tend to do really well. And so many borderlines, I do believe, when they have some insight and awareness, they do understand that they hurt people. They don't want to do that. And when they're motivated not to lose relationships, they can really thrive in therapy. That being said, you can't make someone want to heal their life. And so it's important to know that. I will say this also, that when I was doing my training back in the 90s, borderline, it did seem like this very extreme, very high-end situation. And I think for a lot of clinicians that their understanding of even diagnosing it properly has been missed, because it can look like other things, it can be in such variations. And sadly, that meant that people who, not blaming us because we're just humans, but that, the stigma that it was this sort of extreme disorder, which it definitely can be, but that got in the way sometimes of getting people the right diagnosis and therefore access to treatment. The next issue, and this isn't really a misconception, but it's important to know this, that just because someone you love has BPD and just because they're in treatment, it doesn't mean that you have to accept their behaviors. Now, I think it makes a big difference when someone is working on their life. I say it all the time that we will give people so much grace and we know they're working on healing their lives. And there can be repairs made and there can be a lot of hurts healed. But if it is a situation where there's been too many wounds for you, or the person is not making enough progress in treatment, it is not your responsibility. As I tell patients all the time, you're not Buddha, you're not Gandhi, you're not God. You don't have to accept everything just because it is something like a mental illness. So that really is up to you. Of course, the people that, have this disorder and love you want you to stick around, and hopefully you can find a way to do that, but sometimes you can't. And you should not feel guilty for protecting yourself, especially in situations where there's been severe abuse, there's no really way to heal, and or you just feel that it's not right for you and you can't do it. You need to set yourself free from that guilt, because it's not incumbent upon you, especially if you were a child to this, to make it okay for your parent, okay? The next sort of misconception is that BPD is rare. The truth is that the statistics really vary based on inpatient and outpatient and the general population, somewhere between 2% to 6% and perhaps more. I think it's actually higher. I think that we often miss this diagnosis. We definitely miss it in men, although we tend to diagnose women more often, like 75% of the time. Men sometimes, as most cases, present a little differently with many different disorders. And so I do think a lot of men are missed and diagnosed as, dealing with PTSD or substance abuse or some other sort of depressive disorder, anxiety disorder, or emotional regulation issue. And so it is not rare. I really do believe, and people post on this channel, I've been noticing, it's been so awesome, have said to me, I feel so validated. Thank you. I didn't really know what this was. I think the more we know, the more we can heal our lives and our stories. And so it's not rare. It's just a matter of us understanding it, hopefully over time, and developing better, diagnostic criteria and training to do so that we can help more people. The next one I see a lot is that people often believe that BPD and bipolar are somehow interchangeable, and they truly are not. They really are their own separate diagnoses. And the problem is that we tend to think of bipolar as, you're bipolar because you change your moods, you're shifting all the time. The biggest difference, and there are many, but between bipolar and borderline is that borderline can shift every day, every hour, every minute. Whereas with bipolar, we tend to go into periods of it being, one way or another. There's not such a frequent shifting of affect regulation and things like that. And the problem with this is that many people I have seen with BPD have been diagnosed as bipolar and then put on medication. And then the medication doesn't work and the medication has side effects. And at this point, there's no medication for borderline. It's a lot more about understanding navigation of the emotional instability and relational instability and all of that stuff. And so they're not the same thing. And it is really important, if you're not sure, with your clinician, with your family member, with yourself, to really try to do the work, because the treatments are different. They can be very different. And every aspect of how we deal with this disorder is going to be really different based on whether it is something like BPD or bipolar. The last issue I think is really important, that's a misconception or myth, is that somehow being a borderline is a choice. It truly is a mental illness. It truly is an illness that causes so much suffering for the person with the disorder and for those who are around the person, who love the person, who are being raised by or living with these people. And because we don't want to stigmatize it as being a choice, why would anyone choose to have something that causes so much pain for themselves and for other people? It truly is a mental disorder. It truly can be treated and healed, but to think that a person with this disorder can just choose to be different isn't fair. Now, this is the caveat I will say. We are not responsible for the things that happen to us, and how we hold the line between, well, I'm like this because of my genetics or because of my abuse or my childhood or just kind of crappy parenting situation. And then also, how do we hold ourselves accountable and that we're still responsible for how we take care of ourselves, how we treat people, how we seek treatment. And I know all of those aren't always easy to do. Treatment can be expensive. Getting help can be difficult, all of these things. But at the root of it is, it's not a choice, but getting treatment can be a choice. And for many, many people it is. At the same time, it's also your choice. If you can no longer engage with someone with this disorder, you've done your best, there's too many wounds, but you do need to know that, it is not something that people just wake up and choose to do, because it truly causes so much suffering for everyone in the situation. So anyway, I hope this was helpful. I hope you will consider subscribing and clicking the bell if you want to get notified when I post new videos. I thank you so much for watching. Please stay safe and well, and I will see you next time. Thanks, guys. Bye.